Hello students, today we will be completing the antibiotics. The first antibiotics of today's lecture is erythromycin. So erythromycin was isolated in 1952 from the culture filtrates of Streptomyces erythris by McGuire and co-workers. In this fermentation, erythromycin A is the main component accompanied by congeners erythromycin B and erythromycin C. The congeners have activity similar to that of erythromycin A, which is also known as erythromycin. Its nomenclature includes 6,4-dimethylamine, 3-hydroxy-6-methyloxine, 2-il-oxy-14, ethyl-7-toluene, dihydroxy-4,5-hydroxy-4-methoxy-4-dimethyl-oxane, 2-il-oxy-3,5-7-9-11-13, hexamethyl oxycyclotetradecyl 2,10-diene. Erythromycin consists of colorless or slightly yellow crystals, or it may be a white or slightly yellow powder, which is slightly hygroscopic. When heated, it melts at 135 to 140 degrees Celsius, resolidifies and melts again at 190 to 193 degrees Celsius. It is slightly soluble in water, freely soluble in ethanol, and soluble in methanol and chloroform. It dissolves in hydrochloric acid. It is unstable at a pH of 4 or below. An aqueous solution of the substance has a pH of 8 to 10.5. Since erythromycin is very bitter, it is administered as a film or enteric coated tablet or as capsule. It is stable at a pH which is almost neutral. Chemical properties. Derivatives have been prepared to overcome the bitter taste of erythromycin and also to improve its water solubility. Since it is a monoacid base and contains a dimethyl amino group in its structure, two types of salts have been prepared. One type of derivative was salt formed by the acids such as the glucoheptanate or gluceptate, stearate, and lactobianate. The other types produce the esterification of the hydroxyl group present in the diisosamine part, such as the ethyl carbonate, ethyl succinate, and lauryl sulfate of the propionate. Since the gluceptate and the lactobianate and are water soluble, they are administered parenterally. The stearate is water insoluble in places and so is used in the form of tablets and suspension. The ethyl carbonate, another insoluble salt, is similarly used for children. When erythromycin is mixed with a solution of anhydrol and hydrochloric acid and acetic acid and heated on a water bath, a red color is produced. When erythromycin is dissolved in 7 molar hydrochloric acid and allowed to stand for 20 minutes, a yellow color is produced. Since it is affected by light and is also slightly hygroscopic, kept in a well-closed light-resistant container in a cool place. It is being used in antibiotics. It is now used normally as an alternative to penicillin to treat infection caused by penicillinase producing organisms and in penicillin allergic patients such as streptococcus pharyngitis, tonsillitis, etc., and respiratory infection caused by pneumococci. It is used in diphtheria along with antitoxin. It is also used in penicillin-resistant staphylococcal infection. However, many organisms have acquired resistance to erythromycin and this has limited its use. Official erythromycin IPVP, erythromycin tablet IPVP, erythromycin estrolate IPVP, erythromycin estrolate tablet IP, erythromycin estrolate capsules PP, erythromycin stearate IPVP, erythromycin stearate tablet IPVP, erythromycin thiocyanate BP, erythromycin lactobianate BP, erythromycin lactobianate intravenous infusion BP, brand name erythromycin A, erythromycin stearate, erythrocin, ectrosin, eristal, erythromycin estrolate, erythrocin, emycin, erythromycin sulfate, erinate. The next is gentamicin. The nomenclature includes 2,4,6-diamino, 3,3-amino, 6,1-methylamino, ethyl, oxane 2-iol, oxy 2-hydroxy, chlorhexy, oxy-5-methyl, 4-methylamino, oxane 3,5-diol. Gentamicin is a mixture of antibiotics produced by fermentation of Micromonospora bacteria. It consists of three closely related compounds. It consists of three closely related compounds: gentamicin C, C1, C2, and C1A, and gentamicin A. It occurs as a white powder which is freely soluble in water, soluble in methanol, ethanol, and acetone, and practically insoluble in chloroform and benzene. It forms salts with acid, and the sulfate is being used clinically. Gentamicin sulfate. It is a mixture of sulfates of the antibiotic present in gentamicin. It is a white or almost white powder and it is hygroscopic. It is freely soluble in water and practically insoluble in ethanol and ether and chloroform. Stored in a well-closed container, the container should be sterile and sealed to exclude microorganisms if it is to be used for manufacturing injections or eye drop. It is very potent and useful, powerful product spectrum antibiotic, useful especially again Gram-negative organism. It is the cheapest aminoglycoside antibiotic. It is used to treat critically ill patient and also burns, urinary tract infection, septicemia, osteomyelitis, ear infection, etc. It is used to treat endocarditis due to streptococci, enterococci, etc. It is also used to treat a variety of skin infection. It is especially valuable in treating patients with impaired food defense, such as those receiving anti-cancer drugs or high dose of corticosteroids, and also those being treated for AIDS. The patients are gentamicin sulfate IPVP, gentamicin sulfate eye drop IPVP, gentamicin sulfate injection IPVP, gentamicin cream BP, gentamicin ointment BP. Brand names are garamycin, gentasporin, genticin, or rifobacin. The neomycin include 5 amino 2 amino methyl 646 diamino 24 3 amino 6 amino methyl 4,5 dihydroxyoxin 2 aryl oxy 3 hydroxy 5-hydroxymethyloxylane 2-aryl oxy 3-hydroxycyclohexyl oxyoxane 3,4-diol. It is a mixture of three substances, neomycin A, B, C, and was isolated in 1949 from the culture of Streptomyces faraday. Neomycin A is nothing but a basic disaccharide which is present in neomycin B and C. Neomycin B and C contain four carbohydrate units and they differ from each other only in the configuration of the amino methyl group in the neosamine ring attached to the ribose. Neomycin sulfate is a mixture of the sulfates of the substances obtained from by the growth of certain selected strains of Streptomyces faraday. It is white or yellowish white powder without odor. It is hygroscopic and its solution darkens on exposure to light. It is freely soluble in water, very slightly soluble in ethanol, and practically insoluble in acetone, chloroform, and ether. When pyridine and anhydrine are added to an aqueous solution of the substance and heated on a water bath at 70 degrees Celsius for 10 minutes, a deep violet color is produced. Since it is hygroscopic and also affected by light, store it in tightly closed light-resistant container in a cold place. It is being used as antibiotic. It is a broad-spectrum antibiotic active against a wide range of gram-negative bacilli and some gram-positive cocci. It is poorly absorbed from the gut and is also very toxic to the kidney. Therefore, it is used only locally and not systemically. It is used topically in superficial infections and orally for suppression of bacterial flora in the intestine, especially for preoperative preparation of the bowels. It is used to treat infection, wounds, ear infection, eye infections such as conjunctivitis, ulcers, burns, etc. Features are neomycin sulfate IPVP, neomycin sulfate ear drop IP, neomycin sulfate eye ointment IP, hydrocortisone and neomycin cream BP, hydrocortisone and neomycin eardrop IP. Glycopyrrole 7-chloro-3-46 trimethoxy 5-methyl spiro 1 benzofuran 2,4 cyclohexane 2 in 1,3-dione. Glycopyrrole was recruited by Restrict in 1939 from Penicillium glycopyrrole. However, it received no attention because it had no antibacterial activity. Its clinical utility as an antifungal agent was discovered only around 1960. Chemical it is spiral. Racifalvin is a white or yellowish white powder. The particle size should be as far as possible below 5 millimicron. However, larger particles which may occasionally exceed 30 millimicron may also be present. It is almost odorless. It is practically insoluble in water, soluble in acetone and chloroform, and slightly soluble in ethanol. It is freely soluble in dimethylformamide. In dry state, it is stable for at least 20 months. Racifalvin is dissolved in concentrated sulfuric acid and powder potassium dichromate is added to it. A wine red color is produced. Since it is quite stable, store it in well-closed container. It is being used as an antifungal antibiotic. It is active against certain fungi which actively concentrated. Because of its low water solubility, its absorption is irregular. Absorption can be enhanced by taking it along with fats or by reducing the particle size to millimicron level. It get deposited in skin, hair, and nails. The deposition is more when they are infected with tinea. It is therefore used against tinea infestation of the hair, skin, and nails. It is administered orally in tablets and is ineffective topically. The officials are Cresifulvin IPVP, Cresifulvin tablet IPVP. Brand names are Rysovin, FP, Idifulvin, Gryfulvin, Lamorize, Pyrofulvin. Thank you.